And here in Lagos, the State Primary Healthcare Board, and that's an agency of the Lagos State Ministry of Health, saddled with the coordination of immunization services, says its attempt to vaccinate children from age 0 to 5 years against the poliovirus is meeting stiff resistance in some areas of the state due to myths and unfounded rumors. The objective of the government and its development partners is to administer 2 drops of the novel oral polio vaccine to the children, irrespective of their previous immunization status. The vaccination exercise is to boost immunity of the target group against a circulating poliovirus. The new poliovirus vaccine was developed to address the evolving risk of the circulating poliovirus type. And joining me now here in Lagos via Zoom for more on this situation is the Permanent Secretary of Lagos State Primary Healthcare Board, Dr. Ibrahim Mustafa. Good to have you join us.
Good evening. Thank you very much.
Please talk to us about the resistance being met by your immunization officers and the reasons being given for the rejection.
Yes, thank you very much. We started the vaccination campaign some 2 days ago, on Saturday precisely, what we call the National Immunization Plus Days campaign, which is aimed at intensifying our routine immunization. But prior to this time, what we found out was that some vaccine pessimists have gone online to tell people that they should not allow their children and what to be vaccinated anywhere in Lagos State or even in Nigeria, that the vaccines were meant to sterilize the children, were meant to kill them and all whatnot. And this vaccine that we're giving is something we have been giving our children all along as part of the routine immunization. But with this negative publicity that is going on in the social media, many people are apprehensive. And today and throughout the weekend, we have parents that were vehemently saying they didn't want their children to be vaccinated. Well, we were able to convince and let some of these children have the vaccines. But even in some of our schools today and this morning, we went out with our staff to ensure that these children were vaccinated. But to our dismay, we were met with stiff resistance in some of the schools that they will not allow for this vaccination exercise. We were able to meet with some of the administrators of the school and were able to resolve some. But many of these rejections were still left unresolved. And what is this thing aimed at? The polio vaccine we are giving now is what our children have been having even before now, in several years before now, and will continue even after now. So, and this has been proven to be safe.
And that's where I'm going next, Dr. Mustafa, because this seems like the whole COVID-19 vaccine misinformation all over again. But we would like to know, like you've already started talking about, how this vaccine can help. And the advantages that could be lost when parents do not allow their children get vaccinated.
Thank you very much for making that allusion to COVID vaccination. We had a lot of things during the COVID vaccination exercise. We heard that people would die. We heard that some people were getting their skin light up with when you apply bulb to them. All of these were false information. And those of us that had the vaccines up to now, none of us is dead. And nobody has all of these things that they have said. The governor of the state has had the vaccine, nothing has happened. Now, the exercise we're undertaking now, the NIPDS, is mainly targeted at poliovirus. We have the circulating variant of poliovirus that has been discovered in Lagos. And this exercise is aimed essentially to protect our children from contracting this polio virus. And if they do, it leads to paralysis, and that will prevent the child from reaching his or her full potential. I think the other thing is this vaccination exercise that is coming in a few weeks' time, and that's the vaccination exercise that will be targeted at human papilloma virus. Till date, one cancer-causing virus agent that is known to be preventable by vaccine is the human papilloma virus. And in another few weeks, we'll start that vaccination exercise to prevent our girl child from getting infected by this human papilloma virus when they are exposed. If they don't get this vaccination done, they are very susceptible to getting infected with human papilloma virus and then developing cervical cancer in future. So what all this is aimed at is preventing our children from getting unnecessarily infected, getting dying unnecessarily, and putting them at the optimal health they can ever be. And that's Lagos State government. Thank you.
And we're hoping that the parents listen to you because we know how deadly the polio is, and not just for polio, for every other diseases that have vaccination. We hope that parents listen to you. Thank you so much for talking to us. The Lagos State Permanent Secretary, Lagos State Primary Healthcare Board, Dr. Ibrahim Mustafa.
Thank you very much.